So our study was about the survival outcomes in unilateral retinoblastoma patients and who had upfront enucleation. So retinoblastoma, it's a very common malignancy in children, especially in lower middle income countries. Our patients, they present with a very advanced disease. So our study was about the outcomes based on the histopathological risk stratification. It was a retrospective descriptive study in which we enrolled all the patients who presented to Shaukat Khanum Cancer Hospital and who had upfront enucleation was done in these patients. So what we observed among our patients was that all the patients who had an upfront enucleation, they had advanced disease. So when we categorize the advanced disease, we take them as group D and group E disease. So among our patients, the group D and E disease was commonly present. And unfortunately, we don't have access to the interventional methodologies such as intraocular chemotherapy. So we cannot offer the globe salvage to these patients. So we found out that since we don't have enough resources, so upfront enucleation is our best chance to save in these patients. What we concluded from the study was that immediate referral to an oncology center, since we are currently in Pakistan, and right now there are only three to four institutes in the whole country that are dealing with pediatric oncology malignancies. So we don't have access to enough resources. So what we want to conclude is that urgent referral to an oncology center and early newborn screening should be done among children in neonates in low and middle income countries. And then ophthalmologists should immediately refer the patients to a pediatric oncologist so that the globe can be salvaged. But since, as I've mentioned earlier, we don't have enough resources to the intraocular chemotherapy and other modalities, so we cannot salvage the globe. So to minimize the risk of metastatic disease, what we suggest is that instead of giving a chance of salvaging the globe, we would recommend an upfront enucleation in unilateral advanced group D and E disease. What we are trying is that recently in Pakistan, I would like to mention that one of our colleagues at Lahore General Hospital, they have started intraarterial chemotherapy. The results are yet to be awaited, but we are working here. I mean, all of my colleagues all over the country, they're working with minimal resources, and we are trying our best to salvage the globes in these patients. And recently, under the leadership of Pakistan Society of Pediatric Oncology, we have started our retinoblastoma cancer registry, and a new national protocol has been introduced, which is started. The results are yet to be seen, but we have started our own protocol and follow up to minimize the risk of metastatic disease and to have early globe salvage among these patients.